Hi, everyone. This is the Type 2 Diabetes project. We have Emma Ortiz, Wayne Dorman, Jessica Altman Pollock. For the next slide. Type 2 diabetes is also known as non-insulin dependent diabetes mellitus, that almost 95% of people who are affected by diabetes have type 2. So some of the risk factors for type 2 diabetes do include being overweight or population who are obese. The family history, of course, of type 2 diabetes that really increases the predisposition for an individual to have type 2. And if the person is already diagnosed with a pre-diabetic diagnosis, and that increases your chances of having type 2 diabetes. Of course, one thing to consider is that with childhood diabetes increasing, that actually puts children at risk of having type 2 diabetes. So early onset diabetes very quickly in childhood because of that. So some of the things to look out for, the signs and symptoms of type 2 diabetes would be if you have any possible hypoglycemia, polyuria, polydipsia, polyphagia, if you find that you have extreme fatigue or chronic infections that just won't go away, or wounds that just seem to never heal, slow healing. Definitely, if you're noticing any eyesight problems, all of these are things to consider. And if you see that, make sure to see your provider, make an appointment to get tested for type 2 diabetes.
So I'm going to cover some of the diagnostic criteria. And I think something that is very important to note in type 2 diabetes is the diagnosis usually aligns with the signs and symptoms. The classic signs, such as the 3 Ps, polyuria, polydipsia, polyphagia, they're very common when typically they diagnose someone with diabetes mellitus. Some other more laboratory type diagnostic tests include the various plasma glucose tests, such as a random plasma glucose, where they measure the concentration literally of glucose in your blood at random times. A fasting glucose is performed when you fast. You come in and get your sample drawn and without eating or drinking any carbohydrate or sugar. And typically, if your range is getting up above 100 or above about 126, it's often an indicator of type 2 diabetes. Another version is where they do call the postprandial plasma glucose, and it's when they have you, it's kind of the opposite of a fasting glucose test. They have you drink a sugary beverage. 2 hours later, they measure your glucose, and if it's over 200, it typically is indicative of diabetes. Another tool that's very important, not only in the diagnosis of type 2 diabetes, but it's also the glycosylated hemoglobin test, an A1C. And this is kind of an extraordinary test. Essentially, your hemoglobin molecules in your blood get saturated with sugar. It's called glycosylated hemoglobin. And your red blood cells have a life cycle of the red blood cell of about 120 days. And they can measure how saturated your hemoglobin cells are with sugar, and it sort of tells you where you're at in terms of average blood sugar over a length of about 120 days. Very important in not only the management of type 2 diabetes, but also diagnoses. Thank goodness there are treatment options. A big one is glucose monitoring. You check your blood sugar before meals, at bedtime. You see if you're right in a range, then you dose insulin appropriately. You can perform insulin injections via single shot injections, or they have insulin pumps. Adhering to therapeutic insulin regimes is very important for tissue perfusion. And that's why you see when patients are not well managed with their diabetes, they have a mismanagement of monitoring glucose and administering insulin. That's where the medication adherence comes into play. Very important in treating diabetes. Some of the other things that people can do that's equally as important is diet and exercise. Exercise actually reduces blood glucose by encouraging the reuptake of glucose by the muscle cells. The body also makes better use of insulin through exercise. Diet, of course, is very important, and diet plans are not universal, rather they are individualized. So what diet works for one may not work for another. Stress management is very important for diabetes maintenance, and it's actually been shown that stress hormones have been shown to increase blood glucose levels. So managing stress also a very important treatment option.
Okay, and I have the nursing interventions now. The nurse will teach the patient to follow a low in simple sugars, low in fat, high in fiber, and whole grains diet. So what you would want to do is make sure to teach the patient about eating a low fat, high in fiber diet with preferably 3 meals a day, plus an evening snack. Reduced refined and simple sugars such as candy and soda, and also reduce complex carbohydrates like cereals and rice. The next is the nurse will verbalize and provide printed material to the client on the side effects of unmanaged diabetes. And so here you would want to teach the client how to independently monitor their blood glucose. The blood glucose should be checked before meals and at bedtime. Signs and symptoms of hypoglycemia, and also how to treat hypoglycemia with juice or a snack. And the nurse will demonstrate to the client how to check blood sugars and give insulin injections properly, and will ask the patient to reciprocate. So here you would want to teach about peak of action and duration of insulin. Long-acting insulin, such as Lantus, is injected once or twice daily. Rapid-acting insulins, like Novolog or Humalog, would be injected before or after eating. And prandial insulins, such as Humulin, would be injected 30 minutes before meals. Most importantly, you'd want to teach the client to rotate injection sites to prevent the lipodystrophy. And under client education, you would want to teach them to develop a healthy eating and activity plan, test their blood sugar and keep record of the results, recognize the signs of high and low blood sugar and what to do about it. If needed, you give yourself insulin by syringe, pen, or pump. Monitor your feet, skin, and eyes to catch problems early. Buy diabetes supplies and store them properly. And manage stress and deal with daily diabetes care.
Here's a list of our references used if anyone would like to take a look at some of those and if any other information they would like. Thank you for listening to our presentation on diabetes mellitus type 2.
Thank you.
Okay, so now it's time to play the type 2 diabetes trivia game. Test your knowledge and have some fun. So the instructions are though divided into easy, medium, and hard questions. Each question has one correct answer. Do your best to try to answer it in the time allotted. First one's an easy one. Get ready. True or false? Type 2 diabetes is the most common type of diabetes. True. 90 to 95% of all diabetes cases are type 2. Yes or no? Does being overweight increase your risk of developing type 2 diabetes? We told you these ones would be easy. Yes, of course it does. Research suggests that people are 80 times more likely to develop type 2 diabetes than those with normal body weight. Here comes a medium one. True or false? A low-carb diet is the best diet for people with type 2 diabetes. There's actually no best diet. This is a false one. Food and exercise plans are actually geared and customized. They're not broad or general. Question 2. If you have type 2 diabetes, will you always have to take medicine? Yes or no? No. Many people can maintain good blood sugars without any medicine. Diet, exercise, stress management, all those good non-pharmacological treatment options. And here comes some hard ones. Here we go. So, NCLEX style question. So your patient's blood sugar is 215. The patient is about to eat lunch. Per sliding scale, you administer 4 units of insulin. So what do you know the patient is most risk for developing hypoglycemia? And it's B. You guys didn't really get an option, but it's B. Peak time is the correct answer. Here's another NCLEX. A patient is admitted to the hospital with signs and symptoms of diabetes. The findings of the nurse likely to observe in the client: excessive thirst, weight gain, constipation. 1, 4, and 6. We all know the 3 Ps. Starving, lack of glucose. Clients with diabetes usually do not present with constipation. All right, how many did you guys get right? Was it tough? Was it helpful? We hope either way you enjoyed the little game at the end of our presentation. And here's some more references.